The following segment is sponsored by Grace Internal Medicine.
To get the most out of a doctor visit, it's good to know what to expect and how you can prepare for it. Dr. Leon Buffalo is joining us now from Grace Internal Medicine in Simpsonville to talk about it. Good morning, doctor.
Good morning, Margaret. Thanks for having me.
Glad you're here. You know, we never want to see a patient leave the doctor's office feeling like their concerns aren't addressed. That's what you say, but that happens, doesn't it? So what goes wrong? Is it that patients are intimidated?
Most of the time, it's a lack of communication between the physician and the patient.
Yeah, and you really have to encourage people to keep that communication up. You say before the patient comes in, they should put some thought into their own agenda and what they want to talk about. How do they do that?
For sure. Well, when you go to see your physician, say for a chronic follow-up, in the back of your physician's mind, he's thinking about your chronic illnesses such as hypertension, diabetes, high cholesterol. If you haven't seen that physician for 4 to 6 months, you may be thinking about some things that's bothering you over the past 4 months, like your shoulder, your knee, or some abdominal pain. So you may have an agenda to get some of your acute care issues taken care of, but he or she is thinking about your chronic illnesses. So communication in that sense is very key. So you go in with a list of issues that may be bothering you, or sometimes I'll have my patients just call ahead, send me a MyChart message, or send me an email, just letting me know what's going on.
And you've said, patients should schedule an acute visit dedicated to that main concern or tell the doctor upfront about the issue. Those are the big takeaways. And list making really makes all the difference, right? I mean, I imagine you get people in that think that they know what they want to say and then they lose some of those points.
Exactly. There's something called white coat syndrome that can drive up the blood pressure, but it also can cause patients to forget why exactly they came in. So I do encourage my patients to make a list, write some things down, and if I have time in that visit to address those issues, I will. If it's something that's very serious, then I will tell them we're going to have to put your chronic visit aside for now because we need the proper time to work up this acute illness that you have.
It's white coat syndrome. I like that. I know that you focus on good communication overall at Grace Internal Medicine. A lot of people have been putting off their regular medical appointments over the last year, though. So what would you say, what do you want them to consider?
Well, for sure, we're still in the middle of a pandemic. We're trying to come out of this safely, but folks have been putting off some of their chronic illness follow-ups as well as some of their cancer screening. So definitely get back out there and get your mammograms, get your colonoscopies, prioritize your health and come out and see us. And you still have the video visits that are available as well if you're just not ready to step out into your physician's office.
All kinds of options that can make it easy, make people feel safe. Now tell us a little bit more about Grace Internal Medicine in general and what sets your practice apart.
Well, I will tell you at Grace Internal Medicine, we really do try to meet all of the medical needs of our patients, and we do that through communication. So we may take a little extra time trying to explain to you just this type of situation. If you have an acute problem, we will tell you, hey, let's put that thing aside, put your chronic issues aside so we can deal with the current problem that's bothering you now. But communication is definitely the key, and we appreciate that here at Grace Internal Medicine.
People love the way you do business and the way you treat patients. Anybody watching can call the number on screen, 757-5177. They can make that appointment. They can come see you in Simpsonville. 114B Hospital Drive is your address. Dr. Buffalo, thanks so much for being here.
Thanks for having me.